All right, so the Alberta government just announced the death numbers. I seen it yesterday. I think Anthony Furey was the first one to talk about it, so good to him. But it's very, very interesting, and just more of the same. In all honesty, um, it's getting really tiring having more and more evidence. It seems like every week that goes by, the data continues to pile up against the paranoid doomsday. We're all going to die. We got to lock down. All these idiots, for lack of a better word. Um, Now, again, I would start out by saying I think the majority of people that support the lockdowns and the mask mandates and all these people, they're people that are just genuinely ignorant. They really have no idea what they're talking about. I think it is genuinely a don't attribute to malice that you can attribute to ignorance scenario. But I do think that the premiers of the world, these mayors, I mean, prime minister for sure. I think these people you can definitely attribute it to malice. But the typical city councilor and especially the average Joe, it's just ignorant people. It's just ignorant people, and that I've seen many polls that they've one in the States, one in the UK that show that the average person thinks like 100 times as many people have died from this than have actually died from it. I think there's other estimates that show it's even higher. So again, the average person grossly overstates the severity and the significance of this whole virus. But again, very interesting numbers in that it's the percentage of people that have had these serious health conditions. Number one, hypertension, 87%, dementia, 57%, cardiovascular disease, 56%, renal disease, 43, diabetes, 41.9, respiratory, 38, cancer, 23, stroke, 20, liver, 3.9, immunodeficiency diseases, 3.2. So again, the first thing to point out is, again, 87% of people that are dying of this have hypertension, right? Simply by not having hypertension, it dramatically reduces your chances of dying from this. And yet, why in the world are these governments and these public health officials not bringing this up? Just based off the fact that the government officials aren't bringing this up, I don't see there's any possible way that you can take these people serious. In my mind, I don't think that there's a possible scenario because if you were to take them seriously, a major caveat has to be they have to be telling people this. The fact that they're not telling people this just goes to show, in my mind, there's a lot of malice going on here. A lot. There's a lot of I mean, you look at Justin Trudeau, the whole Great Reset thing, and I think a lot of people say, oh, the conservative governments, a lot of them are going along with it too. Look at what's going on in Ontario, where like Doug Ford is, yeah, he's a conservative on paper, but he's acting like an authoritarian, right? Even in Alberta, we have Jason Kenney who's constantly talking about, oh, we gotta have balance, and he comes off as one of the more laissez-faire people when it comes to this, and they're still way too far out there. I mean, this is something I can't stand. That I've talked to a couple of the city councilors in my city, and again, most of them won't talk to you, and the ones that will talk to you, again, their typical response is something along the lines of, "Oh, I understand there's arguments on both sides, and we're trying to have a nice balance." But no, we're not having a balance. Are we listening to anything that the people who aren't the paranoid doomsday, we're all going to die, hospitals are going to be overwhelmed crowd? Have we listened to anything that the people who aren't in that group have said? No. The people we're listening to is 100% the paranoid doomsday people, right? The Karens of the world, right? So again, here's the thing when it comes to this kind of stuff too, is that I don't mind. I mean, I do mind a little bit if people disagree with me, but at least I can respect people if they're honest with me. And I think my BS meter has continued to get better and better because of this situation, and that it becomes more and more obvious because I mean, it's so obvious that they're lying to us. It's so obvious they're lying to us because again, nobody can look at these numbers and not come away thinking, hey, we've grossly overstated, at the very least, overstated the severity of this situation, like severely. Like if we just um, told people with hypertension to stay home, we would save far more lives than if we told everybody to stay home, or to do, at the very least, to do what we're doing. Again, but people would say, "Oh, that's unfair. That's authoritarian." But again, it's very funny. These people, they think that it's not authoritarian to force literally everybody to stay home, but it is authoritarian to force a small group of people to stay home. No, again, I don't think we should force anyone to stay home, because I think that it's just a slightly worse version of the flu. And again, a lot of people mock you when you say that, but the numbers are very clear. And that, I mean, if you're healthy, even if you're an older person, if you're relatively healthy, you don't have anything to worry about. The only people that have anything to worry about are very old people or very unhealthy people. Because again, if you have hypertension, you are very unhealthy. And this is the thing too, that people say, "Oh, we got to all this stupid save lives." Are I can't stand that. Number one, because we're not actually saving lives. Um, would we technically save lives of people dying from this if we had a draconian lockdown? A little bit, maybe a little. I don't think it's nearly as much as what a lot of people would think, but you have to look at the big picture. Like anybody with half a brain knows that if you save, let's say, 100 lives by locking down, but 200 people die because of indirect causes of the lockdown, then you didn't get anywhere. And this is something that these people have no idea. Like they're so ignorant, it's not even funny. And again, it's one of the most basic rules of economics, is that when you're evaluating any proposed policy, one of the most important things to consider is, what are the indirect effects of this policy going to be? Because it's the classic example. Let's say the government taxes people $10 million to provide 1,000 jobs, right? They're going to provide 1,000 jobs by taxing this money. If by not taxing that money, more jobs would be created, then you're actually worse off. But again, the ignorant, incredibly naive group of people, which is the majority of the public, it's probably not most people watching this, but it is the majority of public, think, why would you not want to tax that money to create 1,000 jobs, right? But they're so ignorant and dumbed down that they genuinely believe by not taxing said money, you're taking away jobs. But in reality, it's the complete opposite. There'd be more jobs if the money wasn't taxed away, at least in most cases. Um, so again, this is again, like as far as it comes with me, like I'm constantly skeptical of my worldview, because for some people it is rather strong, or coming off as a little outspoken. But every single new piece of evidence that comes out seems to prove me even more right. So that's why I've gotten so much more of a hard line on these issues. I think people bring up, oh, there's a record amount of cases. Well, again, cases don't matter for many reasons. Number one, because a lot of them are false positives. Number two, because they don't act. Just because let's say that you test positive and they know for sure, hypothetically, it's not a false positive. Number one, they don't know, right? They're not directly testing for the virus. They're simply amplifying the bacteria, and I don't know what the exact scientific word for it would be, but they're simply amplifying stuff, um, knowing that that's how they. It's basic. I mean, a good way of putting it, I think, would be that it's an educated guess on whether or not you have the virus. So again, that's the problem with cases, is that number one, a lot of them are false positives, and number two, a lot of them are number two, they don't actually know for sure. And number three, a lot of them are asymptomatic cases. Again, asymptomatic cases, incredibly unlikely to spread, right? I mean, Dr. Fauci has said, you know, asymptomatic spread is not the driving cause of viruses. He never has, never will be. It's not how viruses work. So again, the only thing we need to be worried about are symptomatic cases, right? Symptomatic cases, and I mean, we don't even need to be that worried about them. Not as worried as the paranoid doomsday crowd would have you think. that people definitely should be quarantining if they have a symptomatic case, but deaths is the other thing we should be worried about. But again, you have to take these numbers into context, right? Like people, a good way of putting it too would be to ask, okay, for someone like me, or for probably most people watching this, well, what would it take for you to actually be worried about this whole virus situation? Because I don't think we should be a little bit more worried than the flu. And again, considering the fact that we've never been worried about the flu, we the vast majority of people should be living a normal life right now. But again, what would it take to be worried? I would say the best thing would be healthy people, specifically young and healthy people, are dying of this and dying of this commonly, not like one in 100,000. Again, because the numbers are, I think the flu is about zero point 0.1, and again, for young people, especially young healthy people, it's less than 1 in 10,000. It's pretty much a statistical anomaly. So again, like for me to be worried, it would be like I want to see a death rate of at least 1%, preferably like 3 or 4 or 5% for young and healthy people. That would be what it would take for me to be legitimately worried. But considering the fact that we are orders of magnitude away from that, I'm not going to be worried. So again, very confident in saying that. So anyway, the next thing to bring up is from Andy Bird here on Twitter saying, I don't drink or smoke, I eat healthy and exercise every day, yet I'm treated like radioactive waste in supermarkets and stared at by obese people wearing bacteria-filled rag across their face due to not wearing one myself. The world has gone mad. Now again, I have been in a grocery store, I think a few times now, without wearing a mask, and actually, it's been better than what I thought. I think partially because I think it's Save On Foods. I think Save On Foods. I don't know if it's nationally, but I know in Vancouver, I think they don't have it. And I know in the city I live in, they don't have it either. Now, literally everybody in there but me that I seen had a mask. But again, I've been like I say, I've been in there a few times. I've only got one crazy look, and it was because someone was, oh, you're going down the aisle the wrong way, even though they had no lines, or at least I didn't see them from what I could say. So nobody mentioned the mask, right? I walk by probably at least 4 or 5 employees. Nobody said anything. So, and here's the other thing too. I was talking to a family member yesterday, and they run a business that has a pretty good amount of people go through it on a daily basis. Not like a Walmart or something that big, but a medium-sized business probably, and um, they have been talking, or at the very least overhearing a lot. I mean, I asked them directly because I know they're a little bit skeptical of this whole situation, but not nearly as much as I am. And I asked them directly, what are you hearing from people when it comes to this whole situation? And they said, surprisingly, the vast majority of people do not support this stuff. Now, again, they didn't directly say the vast majority of people support the lockdowns, or sorry, are against the lockdowns, but they said the vast majority of people are happy and wanting to be out in public and wanting to have a normal life. So I do believe that it is the minority of people that want these lockdown measures and mask mandates and all this garbage. Because again, when I look online, I do see a pretty good amount of people that support this kind of stuff. I guess partially because I seek out opposing points of views a lot, but in person, I've only met a handful of people, and of the people I've talked to that asked, I've probably, hundreds of people, when you consider, and I only know of a handful of people that support it. I mean, I've talked to probably 20 people directly, and only I think three are people that are paranoid about this. So again, I think it's the minority of people that are like this. I think the big problem though is that when it comes to other people, the average person's big on these rules and regulations, but when it comes to them, all of a sudden they don't like the regulations, right? Like, everybody likes, oh, we gotta, or sorry, not everybody, but a lot of these people, you see it with, I mean, teachers, perfect example. It's, oh, we gotta have all these rules and regulations and stuff, but the minute you say, okay, well, if you want to have rules and regulations that force other people to work, then we're going to pay you less, or we're not going to pay you, right? And then the minute you bring that up, it's, oh yeah, okay, well, we're fine with it. In other words, these people are just bluffing, right? And that most people, again, they're big on the rules and regulations, but the minute it affects their freedoms and the things they like doing, then all of a sudden they're against it. But again, a lot of these people are people who lockdowns would not affect them whatsoever. They're like the stay-at-home moms. They're the boomers that have just retired. Like it's people that whether or not there's lockdowns doesn't affect them at all, right? And that's the thing too, that I really don't care about someone's opinion unless they have skin in the game, unless they stand to lose by imposing said lockdowns or mask mandates. I don't care what their opinion is, right? I really don't. Like, again, you have these doctors coming out all the time. Again, I don't care about you guys' opinion because most of them have been wrong about pretty much everything up until this point. I mean, look at Tam. They've been wrong about everything. Their initial recommendations were wrong, and their recommendations now are wrong. Again, this is the thing that bothers me a lot. It's so much about these kind of people is that it boggles my mind that these people have been wrong so much. Like you'd think that they would get tired of being wrong. Like if I was that wrong, I would stop making videos. I would be embarrassed. But again, it shocks me that these people are still up there and still so vocal. The next thing is from Rand Paul here, and he says, to all the scientific illiterates denying immunity after infection, realize that you are denying the science of natural immunity, which is the foundation of vaccine science. Even Fauci admits to immunity after the virus. Now, again, this is something that another one of the doomsday things that you hear. It's, oh, people have been reinfected, and the immunity is only temporary, even though I think there is a handful of cases, it is still the exception to the rule. And that's the other thing too, is that if that is the case, then why in the world would that's just more evidence for not wanting to take the vaccine. If you got to take the vaccine 2, 3, 4 times a year, what is the point? Right? And not only that too, that just means the vaccine companies are going to make even more money. I mean, a virus vaccine is going to be worth hundreds of billions of dollars. Again, people don't realize just how much money that there is in this kind of stuff, which again boggles my mind how the left can constantly rally against this corporate corruption and all this stuff, but yet they don't care about the fact that a vaccine is going to literally be worth hundreds of billions in just profit, right? Just profit. That's not including expenses. They don't care about that, right? Like, it's very funny. But again, a very good point by Rand Paul. And again, it's something I've heard floated around that is complete bunk. And again, the other thing to point out too is Rand Paul is a medical doctor as well. Again, he is rather outspoken, and you go through the comments and you see these people that think they know what they're talking about, but again, they're questioning a medical doctor's expertise. When again, 99.999% of people that are questioning people like this have less expertise, right? And the last thing to talk about is from Ezra Levant responding to Global News here, and this is from the whole Trump rally last weekend. Global News: hundreds of people gathered in Washington D.C. to support Trump's unsubstantiated claims that the U.S. presidential election was rigged. And Ezra Levant quotes hundreds in quotes. You just can't believe the media party. And again, you look at the pictures here, and there is conservatively, I would say 100,000 people. I've heard estimates of upwards of in the millions, but there is at least 100,000 people there. And again, like I don't understand. I mean, you look at these pictures here. There's insane. I mean, this goes down for even further in these pictures. Like, how can people how can people see stuff like this and still take the mainstream media seriously? Like this is the thing that of all the things in politics and behind in psychology and the psychology of political views is that I don't understand how people can watch the news, like the mainstream media, and not be incredibly skeptical. Like it boggles my mind. And again, if you understand the science behind cults and that kind of stuff, it all of a sudden makes sense. But again, it boggles. And again, I know people personally that are in this group, so which is why it really bothers me. But again, I don't understand how people can do it. Like, for me, I'm constantly skeptical about pretty much all of my views, and I've done probably hundreds of times more research into this kind of stuff, and yet they're more sure of their views than I am. Again, it's incredibly funny. But again, just add it to the list of reasons to be reasons to not take the mainstream media seriously. So anyway, that's what I wanted to talk about today. If you like the video, make sure you hit that like and subscribe. If you haven't already, make sure you check out those links in the description. Follow me on those other platforms. If you want to donate, you can do that as well. Like I say, check out those links, hit that like and subscribe if you haven't already, and stay tuned for more.